So TRC call to action number 18, and understanding the current state of Indigenous health as a result of government policy. So we have a long trajectory in Canada as a colonial state of trying to variously assimilate or quote unquote integrate Indigenous peoples into the so-called body politic. And the TRC itself dealt with one of the most concrete and damaging examples of that, which is the Indian residential school system. So it was stated policy or the stated intent of the residential school system to kill the Indian in the child. And in fact, in 2008, when Harper made the federal apology for residential schools, he did reference that direct quote. And so the intention of the residential schools was to disconnect Indigenous people from their family and the community, because that is where culture and identity are held. And so it is more difficult to assimilate people if they are in connection still with their family and community, which obviously reinforce or uphold their identity. So deliberate disruption of family and community ties. It was a policy that residential school students, who were referred to as inmates, only spoke English, and they were often punished if they spoke their own languages. And so that language disruption being another action focused on assimilation. And then the nature of the education that residential school survivors went through was predominantly trade-based or servant-based. And this was, again, reinforcing the idea that they were inferior and would not be, they could not be prepared for full participation in society, but rather participation as servants, essentially. Now, there were generations of students, generations of Indigenous people who went to residential schools and who learned parenting at the hands of priests and nuns with very high rates of physical and sexual abuse. And that really disrupted a lot of the kinship ties and undermined the passing on of knowledge around parenting. And then there were these complex trauma responses as well. And so people are leaving the residential schools, there are the family effects that are coming out from that. And then as the residential school era is winding down, we have the upswing of the 60s scoop, which really continued on the government's policy and trajectory of removing Indigenous kids from Indigenous families. So this is really over more than 100 years, several policies of disrupting kinship ties and removing Indigenous kids. And so this has resulted in complex trauma. It is one of the reasons that Indigenous people are more likely to be involved in the justice system, with all of the attendant negative health effects of that. And this is on top of broader social policies that create income inequality and housing insecurity, food insecurity, the chronic underfunding of First Nations education. And so all of these things are policies that are acting in the same direction to negatively impact Indigenous people's health. I mentioned the substance use, mentioned higher smoking rates, but there are even studies that are coming out now that show how the chronic malnutrition in residential schools is linked to higher rates of diseases like type 2 diabetes, hypertension, hyperlipidemia, and then those increase the risk for things like heart disease and stroke. So that is importantly how we have to understand Indigenous health so that our interventions can target the right root causes. And so the things that we can start to do to change this are to ensure that, because these are structural mechanisms that create Indigenous health gaps, their policies, their legislation, that we are working on structural solutions. So have we actually fixed funding so that equitable funding for First Nations education is in place? And considering the long time of inequitable funding and of actual harmful education through residential schools, does that actually mean relatively more funding for First Nations education compared to the general population or to provincial schools. Within provinces and within provincial school systems we looked at where Indigenous students are going, which tend to be clustered in low-income neighborhoods, and looked at the funding formulas for those schools to ensure that they have access to the highest quality of education also. What type of social and public housing policies are in place to ensure that Indigenous kids are growing up in safe spaces? What type of recreational opportunities are in place? How is Indigenous leadership over culture-based healing programs core funded as part of a system that supports health and well-being for Indigenous peoples? I think those are all the types of action that we need to do differently to change the policy and legislative environment that creates the opportunity where there's either equitable opportunity to be healthy or inequitable opportunity.